Welcome back. We're going to continue our conversation about public health, public policy today, and we're going to focus a little bit more on the process in this session. I want you to consider one thing at the front end, and that is that what I like to promote is what I call an action-oriented approach to policy development. So what we do is we create what I call policy action plans. So the focus there is on the word action. It's an action-oriented approach, and we'll be giving some tools to you on how to create an action-oriented approach over time. In this session, we're going to focus on the process. You'll recall from last session what we focused on was setting the stage. Who are the governmental policy makers? What are the policy making fora that we deal within? We also, as you'll recall, I had kind of a three-dimensional governmental infrastructure, and then laying behind that was the non-governmental infrastructure that supports the governmental infrastructure. And this is non-governmental or stakeholders, as you'll recall. And we will come back to this concept of stakeholders throughout the remainder of the sessions. We'll touch on them a bit today, but we will have plenty of time to focus on the stakeholder analysis component of the policy making and action-oriented policy making process. So what we need to do today is really look at how an initiative becomes a formal policy. That's what we're really focusing on today. And what we need to do is really think about the elements of that. The first element, for instance, is to formalize, to look at what you're trying to do with an initiative and formalize it into language that makes sense to a policymaker or several policymakers. So, for instance, I have an example for you. I have done much of my work around obesity prevention. And so I have this form here. And one of my first tasks in formulating an action-oriented approach to obesity prevention, and this was particularly around childhood obesity, was to find this child health examination form wherein a doctor measures the weight and height of children, and then this form is submitted to the school for their files. What we were able to do in an action-oriented policy approach was to include BMI, body mass index, on this child health examination form. So that's an example that I'll use today and come back to, and it's actually on the form right here. It talks about BMI. So we were successful in Illinois on getting BMI on the child health examination form. So the first step in the policy process is formalizing the policy request. And what I mean there is language. So in this case, in a very simple format, and again what we'll do is we will do some exercises through our virtual workspace on developing language and looking at language and types of language. But just very simply put, in this case, in our BMI case, we wanted language something along the lines of the child health examination form shall include BMI, and the physician shall take that measurement and record it on the form. So again, very formal, very succinct, very detailed language, and most important from a practical perspective is simple language. So we'll come back to that, but that is the first step, is formalizing the policy request. The second step is identifying policymakers to promote the initiative. And the policymakers in this context have a very kind of term of art title, which is called a sponsor. You may have heard that term before. So a sponsor of a bill or resolution or piece of legislation. The policy tools that we talked about last week, the formal policy instruments, the legislation, the resolution, the executive orders, etc. So we find a sponsor of a policy initiative. And what I like to call these folks more informally is what I call a policy paramour. A policy paramour. And this is my way of defining those policymakers that are going to be our go-to people, that are going to be excited about our policy initiative, that are going to be interested in working with us. Now, the key is identifying the who in terms of who is going to be your policy paramour. Now, there's a couple of different things to assess when determining, as part of your policy action plan, who your policy paramour or paramours are going to be. One of the keys is who's interested in obesity prevention, for instance. What policymakers are interested? And how do we know that? We know that from what a policymaker's passion is. I like to say that experience drives passion, and passion drives policy. It's a very, very important concept that carries throughout my work and the work of policymakers. Passion drives policy. So we look at individuals who have a passion for working on particular topics. Policymakers get involved in the political process, and remember from last time, we balanced the politics and policy. Oftentimes, policymakers get involved in the political process because of their passion for a given topic. So in this case, for instance, we find policymakers that have an interest in obesity prevention. We find that by looking, have they sponsored other pieces of legislation or other initiatives that, that relate to obesity prevention? Do they have a personal story? Have they themselves been obese and then gotten healthy? That happens a lot. I mean, obesity is one of those issues that touches a lot of people. Do they have a family member? Is this something of interest to them as a person? Are they passionate about it? The second thing we might look to for policy paramours is their constituency. So for instance, in this case, we know that childhood obesity impacts African American children living in urban areas at a higher percentage than other children. So if we look at policymakers who have a large constituency of African American children, then they may have more of a stake in being a policy paramour on the issue of childhood obesity prevention. So oftentimes we'll look at the constituency of a policymaker to determine whether or not they would be a good policy paramour. Oftentimes we look at their interest in the topic. The other drilling down things we look to are their position in the policy making venue. For instance, are they a leader? We look to policymakers that are leaders to help promote our initiatives. So, does the person have a leadership position in their chamber in general? Are they the speaker or the president of the Senate? Or maybe they're a leader in that they chair a particular committee. So we have leader and we have committee leader. So for instance, we may see that an issue like obesity prevention, childhood obesity prevention, will go before the Public Health Committee. And so we look to the Public Health Committee membership and leadership as potential policy paramours. We also look to issues like seniority. That's another leadership characteristic. I apologize for the handwriting there. Let me rewrite that. Seniority. How long have they served in the legislative body? Very, very important component. Then we look at things like the committee membership. That's always an important thing to look at. Who is going to be looking at this particular initiative? Are they going to have an opportunity to weigh in on it? So those are characteristics of policy paramours. We also looked at things like relationships. For instance, your own personal relationships with policymakers. And one of the assignments that you will have or have had is to identify your own policymakers that represent you, where you register to vote or where you reside. So that's an important component, is your own relationships, or those of the stakeholders that are engaged in the initiative. Do they have relationships with particular policy makers to make them policy paramours? So these are kind of the second step then, is identifying the policy makers that are going to promote the initiative. And we look at those as our policy paramours. And we look at their interest base and their constituent base, and we look at their specific strategic position in the policy-making body. I'm going to erase this. And I'll simply summarize it by saying policy paramour. Then one of the things that we have to do is determine, and these kind of happen around the same time, what I call the policy entry point. The policy entry point. Does this make more sense as an initiative to work at the local level, the regional level, the state level, or the federal level? And you'll recall from the last session that we broke down the analysis of what those levels mean. So in this case, this form that I'm using as the example today is a state form. So what we do is we look at the policy entry point of changing the form at the state level. Now, truth be told, when you are working an initiative like, for instance, childhood obesity prevention, you'll have multiple entry points. But strategically, you have to determine which specific policy initiative gets promoted in which legislative or policy-making venue. So that is really the key part of the analysis, the strategic policy entry point. So these are kind of the key points of inquiry, the policy paramour and the policy entry point. Then what we do is we go through the process. The process really is, sometimes it's called how a bill becomes law. I like to think of it more, how does an initiative become a formal policy? And I will post in our resource, our virtual resource room, some resources for you to look graphically in more detail of how an initiative becomes law. But in essence, what happens in just a very kind of turnkey way, and I'm just going to give this to you in a very kind of short nutshell of the way that it actually works, is you have a sponsor, the bill is filed, and given a number. Then, typically, the bill will go to a Rules or Assignments Committee, and then from that point, the bill is either goes forward, it's either voted yes or no. If it's no in the Assignments Committee, then the bill is dead, and you have to start from scratch. If the bill gets out of assignments, it is then submitted to a substantive committee. So, in this case, when you're talking about obesity prevention, the bill will likely be posted to a public health committee or a committee that deals with public health issues. So in that committee is where a lot of the action occurs. The bill is read in that committee, it's debated in that committee, and of course, importantly, as we'll see in a future session, there's testimony provided in that committee. And that's one of the exercises that you'll have, is to kind of see testimony that's provided in committee. So in the substantive committee then, the bill is either voted yes or no. If it's no, it's dead. If it's yes, it goes on to the floor. The floor of the introducing chamber. So for instance, if it's a House bill, it will go to the House floor after being in the House committee from the House Assignments Committee. If it's a Senate bill, it will go to the Senate floor after being in a Senate committee from the Senate assignments. And here, and again, there's a lot to talk about here, but we'll have the discussion virtually, is the debate on the floor and a couple of different votes. But once again, the bill is either voted yes or no, yay or nay. If it's no, the bill is dead, and once again, you need to start from scratch. If it's yes, then what happens is the bill then moves to the other chamber. So if we started in the House, we now move to the Senate. And in the Senate, the process is basically repeated. You have a Senate sponsor, assignments, yay or nay, substantive committee, yay or nay, floor, yay or nay, and what happens then is at a final vote, and if it's yay in the final vote, and it's made it both through the House and through the Senate, it goes to the next step, which is to the executive. Whoops, excuse my handwriting. The executive branch, We have a beautiful system in our country of checks and balances. We talked about it a bit last time, about the branches of government, the difference between the legislative branch and the executive branch. And in the formal policy-making process, we have this beautiful synergy between the legislative branch and the executive branch. So when an initiative gets through the legislative branch, through the House, and then into the Senate, and if it makes it that far, then the bill or the initiative goes to the executive for final review. And the executive, for instance, in the case of the state, is, as you'll recall from our conversation last week, the governor. So when the governor gets our obesity prevention initiative that has been formalized as a bill and promoted through the House and the Senate, the governor can either sign the bill, in which case it becomes formal law or a public act. Public act. Or the governor can veto the bill. If the governor vetoes the bill, it returns to the legislative branch and may become law if the legislative branch approves it by a supermajority. So even if the governor vetoes, the executive branch says, no, we don't need to be collecting BMI on these school health forms. It's not a good idea. It's more bureaucratic work. It doesn't make sense from a policy perspective. I don't agree with this. He vetoes it. He sends it back to the legislative branch, and they can either pass it by a supermajority, and then it becomes law, or if they don't, then the initiative is once again dead. Okay? The governor can also do like a mandatory veto, in which case he might say, well, I don't really like the concept of BMI on the form, but I certainly see the advantage of having height and weight measured on the form. And let's assume for the purposes of our conversation that height and weight were not already on the form, which in this case they were. But as an example of an amendatory veto, the governor may say it's too much room for error for doctors to be creating BMIs for all these kids. But what we can do is get the height and weight, and then our public health agency may be able to, manage that information better. So the governor can sign the bill, in which case it becomes an act. He can veto it, and with an override, it becomes an act. Or he can amend mandatory veto, and once again, that has to be approved by a supermajority of the legislative branch to become a public act. Or the fourth option is the governor can do nothing, and then after a certain amount of time, 60 days in some states, it just depends on jurisdiction, then the bill becomes law automatically if the executive branch does nothing. So it's a very interesting interplay. And of course, the governor is very interested in these changes to the law because it impacts the agencies and the administrative side that we reviewed last time, and we'll go into more detail on through our exercises and also as the course continues. So this is basically a nutshell of the process, and there's lots of variations to it. So in summary, I'm going to erase this. And again, I will be posting to the virtual resource room some maps, if you will, of the process. And so you will have some other opportunity to look at it. But in essence, we have formalizing the policy request, identifying the policy parameters, identifying the policy entry point, and working the process. Bill becoming law. So we will continue next time our conversation of how to engage the policymaker, that the rules of engagement for how we get the policy parameters to look at our initiative as really a high priority for them as they move through their work. So we'll be working on that next time. And again, I'll be posting additional materials for you so that you can further study this concept of the policy-making process. And there will also be some exercises for you to conduct. So thank you, and we'll see you next time.